All right, good afternoon and welcome to the Flint Community Webinar on Coronavirus, brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Prevention Research Center. I'm your guest moderator for this week, Heather Lynn Uphold, filling in for Yvonne Lewis, who is out today. I work for Michigan State University, the Flint Center for Health Equity Solutions, and I also serve on the Healthy Flint Research Coordinating Center. And I'm so excited to be here with you today. This week is week 81. Happy October 1st of the webinar series. And you can see the wonderful partners that we have that bring such tremendous support in helping us get this valuable information out to you. And we have a packed lineup of speakers and lots of great topics that we want to get to this week. We'll hear about the Genesee Health System's Autism Center. We've got Shannon Cyber and Emily West who are here to give us an update. We'll also hear from Afton Shavers about what's going on with the Flint ReCAST project. We'll get your questions answered about the timing for flu and COVID vaccines and adverse events and reporting for COVID vaccines as well from Dr. Pam Hackert and Dr. Deborah Verholden. And then we have Dr. Susan Wolford, who's bringing us a medical moment. But we can't miss our important updates from the Genesee County Health Department and Sherelle Brown and the City of Flint. We've got Lottie Ferguson. But first, let's start out with an update from Gary Jones and the Governor's Office. Gary, what do you have for us this week?
Oh, hey, thank you so much for that, Heather. Good afternoon, everyone. So actually, I only have a couple of things here, so I will be brief this afternoon. So the governor recently announced that the U.S. Secretary of Commerce's Economic Development Administration is awarding a $3.8 million CARES Act Recovery Assistance Grant to the University of Michigan Flint to construct the university's new College of Innovation and Technology. This EDA grant is to be matched with a $4.9 million investment in local funds, is expected to create 126 jobs, retain 175 jobs, and generate $10.4 million in private investment. Also recently, the governor signed the budget, which ensures funding is now in place for fiscal year 2022, which begins today, October 1. When combined with the K-12 school aid budget signed earlier this year, the total budget invests $70 billion into Michigan's future. The budget provides strong investments for the state's economy, lowers the cost of childcare for Michigan's working families, invests in education and skills for Michigan's workforce, protects access to affordable health care, prioritizes cleaning up our water and environment, and rebuilds crumbling bridges. Also, a few key investments inside of here. It makes a permanent $2.35 per hour raise for direct care workers who have been on the front lines of the pandemic, taking care of our most vulnerable. It also funds treatment for sickle cell disease in Michigan, which impacts over 4,000 people. It expands the Healthy Moms, Healthy Babies program to ensure moms have the support that they need. And also several Flint and Genesee County specific community projects were funded in this budget as well, including our very own Burston Fieldhouse, Flint Public Library, the North Flint Food Market, as well as dollars for blight removal. So I always end with saying michigan.gov/COVID vaccine, as well as michigan.gov/coronavirus, still the best catch-all websites for all updates.
Good stuff. Thanks, Gary. And let me just encourage folks that if you aren't on Gary's email distribution list, you need to be. So reach out to Gary, he'll add you and you can get some really great information from him. And that's just sending an email to you, right, Gary?
Yep. That's all you have to do is just send me an email and say, put me down on the list. At one point, obviously during the pandemic, I was sending them probably every other minute. But now I try to do it, as to make sure I get relevant, and timely information out there. But I promise not to flood anybody's email inboxes now.
All right, good stuff. Thanks, Gary. So now I'd like to invite Dr. Deborah Verholden and Dr. Pam Hackert to the roundtable. Dr. Verholden, last week we talked a little bit about adverse events and reporting related to the COVID vaccine. Can you give us some more information about that?
Yeah, so you hear a lot of the sort of stories, and the media loves to sensationalize the sort of negative events. And we've done a lot of attributing things to COVID that I don't think are actually COVID related. I don't know if people were following, but what's her name? what's the woman's name? Not Cardi B. She's a big, what's her name? The woman who told the story about, her cousin's friend who,
Nicki Minaj.
Nicki Minaj. Nicki Minaj. I'm sorry for all the Cardi B fans because they would take offense to calling Nicki Minaj, but you know what I meant. So, and told the story of, her cousin's friend who was getting married and, one of his testicles swole up and his wife, to be left him. And this happened like, supposedly right after he got the vaccine. So my word of caution to people is, one, don't believe all of the hype that you hear in the media. You just can't. And it's sort of like an unfortunate phenomenon because what people are doing is they're linking everything bad that happens in their life to the vaccine. So imagine if this morning for breakfast, I ate a strawberry and then later in the afternoon, I got in a car accident. I wouldn't say the strawberry caused the car accident. They're coincident. Now, if you have been vaccinated or somebody has been vaccinated and you have some kind of reaction that you think may be attributable to the vaccine, there is a reporting system. I will put the link in the chat, and people should be reporting those adverse events or a suspected adverse event. And you should also let your physician know. Physicians are required to report them, and you yourself have an opportunity to report them. And I will put the link in the chat. But I do caution people, don't believe the hype. I sort of joked about the Nicki Minaj tweet, and I said I would be more curious to find out what happened at the bachelor party. That seemingly would have had more relationship to his problem than the vaccine. So yeah, there is recourse for folks.
All right, good stuff. Thanks for keeping it real for us.
Yes.
As always. All right, Dr. Hackert, we've got a couple questions for you. We're so glad that you could join us today. The first one was, so we're headed into flu season. You talked about this a little bit last week. We're encouraging folks to get that flu vaccine, get their COVID vaccine. Can you talk about timing with that?
So now is the time to get your flu vaccine. This is the perfect time. And you can get both on the same day, perfectly acceptable. And then also they have okayed to get both at any time. You can get the COVID vaccine regardless of when you've got anything else. The only exception really to that is if you have a live virus vaccine, which would be, most commonly it would be like the MMR is a live virus. So, there's not too many times in our lives we get that. Usually it's for little children who can't even get the COVID vaccine yet. So that is really the only one. And if you have gotten the MMR, they do recommend waiting 28 days from a live vaccine. But you can get them both on the same day, a live vaccine and COVID. Perfectly fine. All
right. Good, thank you. We did have another question come up. We always encourage folks to add their questions to the queue or to the chat so we can get them answered live. This question came up, and it was, after testing negative with a rapid test, a person tested positive and was informed that perhaps the rapid test wasn't valid. Can you speak to that?
Yeah, so antigen tests, and that's most of the rapid ones. There's a few, trying to get my sound volume down, sorry, it's really loud. There's a few tests, but they're almost all used up, but there are a few rapid PCR tests, which are the more accurate ones. So really, when we're talking about rapid tests, we are now talking about antigen tests. And you may ask, what's the difference between that? And the antigen test is something that will be, it's a lot cheaper. It's super easy to do. It's generally 15 minutes or 30 minutes max to get that back. When you go to a place and they say it's 3 days, that's going to be your PCR. That one will pick up even a very low baseline, like you're just starting to get sick or you've been sick and you aren't even infectious anymore. It will still pick that up. And that's one of the things that they do as a confirmatory test. But the antigen test is what we have access to all over the community now. And those have about at best 85% accurate to show that if you take the test, it will show you're positive for being infectious that day at that moment. And that's the biggest difference, is it doesn't pick up all those days before you become infectious when you're incubating it. because you have to get a certain viral load before you can actually spread it to others. And it doesn't pick up the ones at the very end. So like 2 weeks after, it wouldn't be picking it up anymore. Those at best have a 85% accuracy for picking up a positive test when it should be picked up. It's higher when you're symptomatic because that's when you usually have at the beginning of symptoms. So 2 days before, first day of symptoms is when it really spikes up and you are really infectious. That's when those tests are going to come back positive most of the time. But still, that's 3 in 20 times it may come back negative. So you have to look at all the pictures. Have you had any reason to be exposed to something else? Like, does someone have the flu? Because it is starting to circulate now. And also, have you been exposed to someone with COVID? If you have symptoms, but your test is negative, you should assume you have COVID as well. And then also keep getting another test back because, that's like 15 people. Well, it's quite high that it has a good chance that you may have been one of the people that didn't work on. If you get a positive antigen test, it's much more accurate. So that's what it's designed to do. It's designed to tell you if you're positive, you really know you're positive, much higher. If you're negative, you need to look at whether you have symptoms, have you been exposed? And those tests work best when you do it like serially. So like every day, every other day. They are using them once a week. I think that's still dragging it out a little too long, but like every other day or every 3 days would be a really good way to use those antigen tests and realize that it's not unexpected to get a negative result. The accuracy is probably more like 75 to 80% accurate if it's negative.
Okay, good. Thank you so much for breaking this down for us and helping us make good decisions for ourselves and our bodies. You mentioned we are headed into flu season, and we do have a great opportunity actually that's coming up with the Genesee Health Plan. We have Jim Milanowski here, who is going to fill us in on this upcoming event. Jim, tell us what can we expect next Friday? What's happening?
Wonderful. Thank you. I was so excited to hear from Dr. Hackert about you can get both the COVID-19 vaccine and your flu shot at the same time. And we have the perfect opportunity next Friday. So at 12 o'clock next Friday, you're going to be on this webinar, everybody, paying attention and learning all the things that we do. Then from 3 to 6 p.m. at the Genesee Health Plan office on Linden Road, we are having our annual flu drive-through vaccine event, and this has been very popular. People can actually drive into our garage bays, roll down their sleeve. A pharmacist will give them their flu shot, and they're in and out like it's an oil change for them. And so, but this year it's going to be a little bit different. We have our partner Genesee Community Health Center has their mobile unit, will be in our parking lot. And they will be able to give COVID-19 vaccines out to people if they come to this event, as well as the health department's going to be inside and giving out not only COVID vaccines, but also other immunizations like Tdap and pneumonia and HPV vaccines. I don't know if I've heard anybody talk in this webinar about what are HPV vaccines, and maybe someday we can address that, but those are important for, ages 26 and under. So really, it's a great event. You can take care of all of this at the same time. So I would encourage you or your loved ones or your colleagues at work to come to that. There's not a better feeling that I get when a car full comes in and it's maybe a mother and father and a grandmother and a child all getting their flu shots together. What a great impact that is on the children to see that really live in action and how their parents are taking it seriously. And so then hopefully they'll take it seriously from then on. And the best thing of all, if you get a shot, you get a free ice cream. So, and I'll be there to give you those. So just go on our website, geneseehealthplan.org for more information, or call us at 844-232-7740.
All right.
So if I could take 1 minute, this is just kind of fun, and you can see me, so you can actually see how I love getting my flu shot. I feel so protected after getting my flu shot, and I can't wait. And then, they came out and said, don't get it in July and August unless you're pregnant, you are concerned. And it was like, okay, I'm going to wait for this is the perfect time to get it. This is exactly the perfect time. It will be built up. By the time we start having Halloween parties, Thanksgiving, Christmas, you will be protected. Those are the times when it really transmits. But it's crazy. Like, I actually got more excited usually about every year about getting my flu shot. I shouldn't say this, than I got about my COVID, because COVID was like, all right, I need this, but the flu shot I really want. It was just crazy. But I think flu shots are the best. I know there's always bad mouthing flu shots about how efficacious they are, but I know I will not die of the flu if I get a flu shot.
Your excitement is contagious. I think we'll join you in getting that too. But what a great event, right? So you can bring the family, get everyone taken care of, get some ice cream from Jim, and then head off on your way. Super convenient. Thanks so much.
Absolutely. Yep.
So our kids have been headed back to school, some for the first time in a long, long time. And it hasn't really been an easy transition for everyone. So we've invited Shannon Cyber. No, I know I said that wrong, Shannon, you'll have to correct me. And Emily West from the Genesee Health System to give us more information about the Autism Center and some resources that are available for parents, caregivers, and kids. Thanks, ladies.
Well, thank you so much for having us. Again, my name is Emily West, and I have been working at the GSA Autism Center for 6 years, both as an ABA technician and also in the role as a social worker.
And I'm Shannon. You're very close, Sivir. I'm a board certified behavior analyst who has been in the field of ABA for almost 10 years, and I'm currently the manager at the Autism Center for Genesee Health System. So talking about, being a board certified behavior analyst and ABA therapy at the Autism Clinic, what is applied behavior analysis even to begin with? It's an evidence-based practice that is utilizing the principles of reinforcement to help increase those behaviors that we want to see, and it helps us to really understand the why behind why a behavior might be happening. Using this, we can then help to develop some functional communication skills, such as maybe pointing to an item that we want or need, or even using vocal language to be able to communicate those desires and those wants. We can help build up some of the skill deficits that we might see to help that learner to be successful in the environment that they're in, or even to help decrease some of those behavioral excesses that we might see. So when I'm talking about a behavioral excess, we might talk about speaking out of turn, or maybe speaking at a volume that's too loud for the classroom environment, or even some of those aggression towards other peers in the classroom. In ABA, we really want to pay close attention to the behaviors that a person is engaging in, specifically more so what's happening right before and what's happening right after that behavior. Using that information, we can make some systematic changes to the environment and better set that person up for success in the future. The science is not exclusive to just autism spectrum disorder. We can use it across many populations, including general education classroom.
So what do we provide at the GSA Autism Center? We are currently serving kids anywhere from 18 months to 15 years of age. What are we working on? We're working on those social skills. So how can they engage in their communities with their parents, with families and loved ones? We're working on receptive skills. So receptive skills meaning their ability to listen and respond to instruction when given. We're working on adaptive skills, so adapting to changes and things that are occurring in the environment. We're also working on academic skills, so things or academic skills that are being presented in the school. So we're providing support in that area. And lastly, we're working on expressive skills, so their ability to not only communicate verbally, but if they are nonverbal, we are getting creative and teaching alternative communication, whether it's gestural communication or using what's referred to as PECS, which is a picture communication system. So they are exchanging pictures of their wants and their needs to their parents, to the technician. Other things that we are implementing are visual schedules and token boards, which Shannon is going to go into further. Typically, when kids start in our program, we're providing that one-to-one setting where they're working with a technician and they're specifically responding to certain instructions being given and immediately being positively reinforced. Once the one-to-one setting has occurred and we're seeing progress, the goal is we want them to generalize those skills. So we want them to move on to a social group, which is for ages 6 and plus. There's obviously some prerequisites for that. What we're looking for is for them to have a certain amount of language and already have some social skills so that that can be implemented in the groups and they're able to best interact. How we're generalizing is we're using mock environments. So we have a mock classroom where a technician is playing the role as teacher. They're standing in front of a whiteboard or standing in front of the classroom giving instruction, and it's truly that natural school setting. And then our ABA technicians are kind of scattered throughout the room, prompting as needed. So we're obviously fading that one-to-one setting out, and we're trying to create a sense of independence and generalize those skills. What we're also doing is we're creating a mock home setting for some of our older kids. So what we might have is we have a living room set up, we have a laundry room, a kitchen, all these different home settings to where they are able to practice independent living skills. And we also have varied topics where they might have to learn how to interact with a waiter or waitress, or how to interact with a store clerk and people in their community, or a police officer. So what we're trying to do in those social groups is we're trying to generalize those skills so that they can take those skills out into their community. Lastly, what we're providing is parent education. So we provide support groups for our families so they are able to meet other parents who have kids on the autism spectrum, and they're able to share resources and support for one another. We also provide trainings one-to-one where our BCBAs and analysts will specifically work on issues that families are facing. But then we also do trainings in group settings as well, where we're targeting a certain topic, whether it's safety or potty training, or teaching them how to like expose them to new different types of foods and desensitization and things like that. So how did the pandemic affect us as a center? Obviously, we had to close our center in March 2020 due to the pandemic, and then that led us to providing virtual services. Those virtual services consisted of those parent trainings over the phone or over Zoom. We were also able to provide social groups for our kiddos who were once participating in those social groups, and we were doing those similar topics. We also were able to provide some one-to-one our analysts were. However, it wasn't as intensive because typically we are providing anywhere from 8 to 16 hours per child. So we weren't able to provide as intensive therapy. We reopened in July 2020, where we were able to serve our most severe cases, families that were in crisis or kids that were regressing. We have been able to provide all of our morning kids and early afternoon clients spots, so they have all returned. However, with our after school program that has always been in high demand, we have always had to manage kids coming into those programs super quickly. That program has been consistently growing. So obviously with staffing barriers that many agencies have been facing, we have had to face a return to center list and getting all of those kids back. So that is our primary focus at this point, is rebuilding and restaffing our after school program so that we can serve all of our families' needs. So concerns going back into the school, this is what we've been hearing families report. This is what we have been hearing schools report, and it's things that we are seeing. So kids have lost that sense of routine. That routine has brought them a sense of security and normalcy. I think even as adults, we can identify and relate to that, and that's been challenging and hard for us. So imagine not only being a child, but throw in an autism diagnosis where it's hard for them to adapt. So we are seeing certain behaviors rise up. We're seeing screaming, we're seeing crying, we're seeing short tempers, and we're seeing this desperate need and wanting of rigidity and consistency. We're also seeing maladaptive behaviors, meaning that we are seeing kids get overstimulated. So this could mean echolalia, this could mean hand flapping, loud noises coming from the child, them wandering off, or other impulsive acts. We're also seeing hyperactivity. So this could mean pacing, inability to focus, roaming around the room. And lastly, we're also seeing some aggression. So this meaning kicking and hitting, and then also property destruction. We're seeing kids ripping up homework. We're seeing stuff related to that. So if you heard about ABA, or this is new to you and you are interested in accessing our services, what I wanted to do is I wanted to break that down. A lot of people just think they can call the Autism Center and boom, they can get into services. There are some steps involved into getting into services. So we broke that down into some easy steps. So the first thing you're going to want to do is you're going to want to call the GHS Access Center to get into the NCE for an assessment, to get an autism diagnosis, and to see if you qualify for ABA services. So the phone number is listed right there. Feel free to take a screenshot or write that number down, because that is going to be your go-to if you want services from us. Once you get the NCE diagnosis, you will be assigned a case manager and you'll be in connection with the Autism Benefit Administrator. So she manages all the wait lists to get into all the different providers that are in the county. You'll get a phone call from her letting you know that there is availability, and then you'll be in direct contact with us, either the GHS Autism Center or the other providers that are in the county. So that is Attendant Care, Marikey, Helping Hands, PBS, and Gateway.
So with all of these concerns that we're having in the school, what can we do to help support our kids? So like Emily mentioned, we have that classroom model that we're doing at the Autism Clinic to really just help up to build some of those softer social skills that our kids are going to need to succeed in the classroom. Maybe sharing toys back and forth, raising their hand before blurting out in classrooms, just some of those things that will really help them to succeed, and providing those additional learning opportunities. Within the Autism Clinic, we have a behavior analyst and even a peer support coordinator that can help provide families with support during things like IEP meetings or even just school consultations. So now I'm going to talk through just a couple of tools that we use and that might be helpful in the classroom, but I'm going to put the caveat in there of please consult with an analyst or the specialist at the school before utilizing, just to make sure that we're doing so successfully, right? So one of the tools that we use a lot is a token board, which is shown in the picture below is one of the examples. So with using a token board, we want to provide the child with small tokens to indicate that they've done something that we want to see more of, right? They completed a desired task. They maybe are sitting really quietly and nicely. They're raising their hand, any of that kind of stuff. You just give them a small little token, almost like those stars below, to show them, hey, you're doing a really great job. The beautiful part of that is it's not disruptive to the bigger classroom. It's really easy to use. And then that child can take those tokens and exchange them for something more worthwhile later on. So whether that be maybe some computer time, some extra time at recess, maybe a yummy snack, anything along those lines that really fits the wants of that child to make it more enticing for them. Another tool that we can use is a visual schedule, which is also displayed here. So this just kind of breaks down what a child would expect in their day, right? I know I like to know what to expect in my day, so I would anticipate that our kids do too. By being able to lay out the day, it just provides an overall structure for their day. It lets them know what to expect. They've gone from such an unstructured last year and a half in the midst of COVID to now they're coming back into this very structured environment. So this helps them just to see what's coming up next, all their tasks that they need to do before the end of the day. It's reducing anxiety. It can lead to more independence, that they know what they're transitioning next, and it can honestly just kind of help keep the classroom on track, right? And then another tool that we use is a social story. So a social story is very much like it sounds, individual short story that we can write or use that can depict a specific social situation that your child may find themselves coming across. They're super easy to use. You can go on Microsoft Word and kind of type out a situation that you know that your kiddo is running into and maybe having a harder time with, and then use it as a prompt to help walk them through and read them that story of, this is the behavior that's expected when this situation comes up at school. I love social stories because they're easy to make. They can be super individualized. You can put your child's name right in it, your teacher's name, maybe some of their friends at school. And then it's a tool that they can use to go back to as often as what they need to see exactly what behavior is expected of them in that specific situation that they might be struggling with. Some other just more general recommendations is to make your expectations clear, and then once those expectations are set, to be consistent and fair with those. So something you see a lot in classrooms is a classroom rule to be respectful, right? Well, that's fantastic, and we want that, absolutely, but what does that mean? It can be interpreted so very differently across different people. So I would encourage you to break that down into, using an indoor voice, not calling out of turn, keeping your hands and feet to yourself. These are the things that we expect in the classroom. Provide as much structure as possible, so maybe through the use of a visual schedule, or even just keeping a consistent routine of how the day goes. So again, those kids know what to expect in the classroom. We always want to preach to catch being good. It's easy to look at the day and look at all of the negative things that happen throughout the day, but to really try to catch those positive moments and reinforce those positive moments. The whole idea behind ABA is that if we reinforce those things that we want to see, we're going to see them happen more often in the future, and the day will only get better and better. So if you're seeing some of those more challenging or problematic behaviors, put your ABA hat on a little bit and think about why those behaviors are happening. What is that child trying to communicate in that moment? Is there a skill deficit that we can help build them up to be successful? And then when they're being successful with it, we can catch them being good and reinforce that opportunity so that we're more likely to see it again in the future. So it's this whole big cycle, but we really just want to look at why that child might be engaging in that behavior. I threw Emily's and my email address up there for any questions, and I saw it go through in the chat as well, and then just some references that we used.
All right, lovely. Thank you so much, ladies, for these great, excuse me, for this great information and reminding us that, there are resources available. We are not alone in sorting through these. You did mention 2 phone numbers, and I wanted to say them just in case folks were here with the listening through the phone. The one for GHS access was 810-257-3740, and then for an NCE diagnosis, that phone number was 810-496-5677. So just in case folks weren't able to see what was up on the screen, we want to make sure that they can have access to that too. But thank you so much, ladies. We're so glad that you were able to be here with us. Next, we're going to turn our attention to get our weekly update from Sherelle Brown at the Genesee County Health Department, where she is the Emergency Preparedness Health Educator. Sherelle, fill us in.
Good afternoon. It's great to be here again today. My information is on the screen if you need to contact me, and we can move on to the next slide. I do want to make you all aware, as most of you know, that Genesee County Health Department did start to offer the Pfizer booster dose as of Wednesday, and that is the only vaccine manufacturer that is currently providing a booster dose that has been approved to be given. So we do have that booster for individuals after 6 months from their original vaccine series, and its specific use is for maintenance dose. Those who are immunosuppressed, they can get a 3rd dose as well as a booster dose, but that booster dose would come 6 months after that 3rd dose. Next slide. And right now in Genesee County, I did not post the dashboard for vaccine distribution just because it had not been updated when I did the presentation, but over 45% of Genesee County has completed their vaccination series, and about 55% has at least had one vaccine. There's been almost 350,000 doses administered throughout and across Genesee County. We are still promoting vaccinations, and we have our 3 standing clinics on Tuesday, Wednesdays, and Thursdays. On Tuesday, Genesee County Health Department will be at Our Lady of Guadalupe from 12 to 2 p.m., where we'll be administering Moderna and Pfizer. On Wednesday, we'll be at Central Church of the Nazarene from 10 to 12 p.m. We administer all 3 doses there, Pfizer, Moderna, and Johnson & Johnson. And then on Thursday, if you can attend some of the early in the day clinics, we do have a later in the day clinic at Shiloh Missionary Baptist Church. That is from 3 to 6 p.m. And we provide Moderna and Pfizer. So we do ask that you come and get your vaccines. You know, we are still in high transmission rates according to the CDC. So it's important that we take precaution, get our vaccinations, and also go get tested. On the screen, you'll see multiple testing sites throughout Genesee County that you can reach for free testing. Word of Life Church, Bethel United Methodist Church, and Macedonian Baptist Church are all places within the community where you can receive your free not vaccine, but your free testing. And then your local Walgreens or Rite Aid also has free testing, as well as Hamilton Community Health Network. If you visit our website at gchd.us, you'll find a listing of specific addresses for the Rite Aids and local Walgreens to go for your testing. Next slide. And also, we all know by now that you don't have to register. All of our clinics are walk-in, and we are serving those who are homebound. If you visit gchd.us under the coronavirus tab, if you scroll all the way down to the bottom of the page and click the link, there's a link at the bottom of the page for homebound COVID-19 vaccine registration. If you click that link, we can get you on our database to come visit your home and provide that vaccine. And if you don't have computer access, just give us a call at 810-344-4800 and we'll set you up for services.
All right, great. Thank you so much, Sherelle, for always keeping us equipped with where to go for testing and how to encourage others to get their vaccine and where they can go for that. Thanks. Up next, we have Dr. Susan Wolford, who is here. We always look forward to learning something new from her. Dr. Wolford, what's on your agenda for us today?
Thanks so much, Evelyn. It's a pleasure to be able to be here today to speak a little bit about the severe effects of COVID-19. So I believe there were some questions about how this happens, and we want to get to discuss the brain a bit, but all of this really starts in the lungs, or a lot of it starts in the lungs. So I thought we could start there. So if we think about our lungs, and remember I've shown this before, these are those little sacs at the end of our airways where the oxygen gets exchanged with the blood vessels. And so those are called alveolar sacs. And then this is just an example of what a capillary, a small blood vessel would look like. And then in between the two is this little space, really not much space at all. We call it an interstitial space, but that's tiny because what we want to happen is for oxygen to cross over into the blood vessels so it can go off to our organs, and for carbon dioxide to come in so we can breathe it out. Well, then along comes COVID, right? So COVID attracts the virus, and any virus would, attracts our immune system to come and destroy it. And so they come along, in this case, I'm showing a macrophage that actually damages the airways or these sacs a little bit. But not only do they damage them themselves, they do more. They actually produce what are called cytokines. These are chemicals, the cyto meaning cell and the kine meaning movement. So these cells cause other cells to move into the area. So these chemicals cause other cells to move into the area, and they call all of these inflammatory cells to come into that space to try to fight off the infection. But as you have heard in COVID, sometimes this happens too much, and there's that cytokine storm. It's too much of it. And that damages the blood vessels, makes them kind of leaky. So the fluid comes out of the blood vessels, all those inflammatory cells come out of the vessels, makes that space in between so much wider. And so now when the oxygen tries to get through, it really can't because it's blocked by all this fluid in the way. And the carbon dioxide has a hard time getting out. So that's why people have a hard time breathing, they feel short of breath. And when this happens around the whole lung, it's a serious problem and people need to be on a ventilator or get other help with getting oxygen into their body. But when we think about low oxygen, there is one organ that we know is very sensitive to when we don't have enough oxygen. And I hear everybody answering, it is the brain, right? That low oxygen is is a problem for our brain. Our brain needs to get enough oxygen. And so we think there are many ways that we feel that coronavirus is damaging the brain and causing some of these neurologic symptoms or brain symptoms that we've been seeing. One of them is the fact that maybe this hypoxia, this low oxygen state, is part of what's damaging it. There are other ways. So it can also, in rare cases, directly get into the brain. So we know it affects our noses, right? Because everybody's aware it stops the smelling and and tasting. And so there's this way that this route that the coronavirus has directly to the brain, up through the area where the olfactory nerves are, those nerves that help you smell. And that way it can get into the brain and cause damage that way. But that was one of the ways we thought in the beginning. It did it a lot, but it doesn't really do it a lot that way. However, it does make you want to put on your mask, doesn't it? So anyway, and then we have to think about the blood vessels. And this is how the immune response comes into play again. Because again, we get these cytokines, this cytokine storm that brings these immune cells into the area. Now, if you remember from your biology in high school, there's a blood-brain barrier, which means that these blood vessels do not let much through at all. They are tight. But when these immune cells come in and in the midst of this cytokine storm, it makes those blood vessels leaky as well. And so damaging agents are able to get into the brain and cause problems. So we really want to protect ourselves from ever getting COVID, because these effects on the brain, we don't fully understand them yet. We're working to, but we don't fully understand it. And there are some other ways which we can talk about another time. We won't have time today. But I do want to spend just a moment. I'm going to stop sharing. And if you want to spotlight me, so you can see me. I want to point out that our brain is really very soft. It's like tofu. I don't know if you can see that. It's like soft tofu. So it needs protection, right? And the way it's protected is being put into a hard shell. I'm a vegetarian. I couldn't find an egg, but I could find a decorative egg. So it's in a hard shell, the hard skull around our brain that is to protect it. But it has more protection than that. As I mentioned, it's covered in this blood-brain barrier, which we see. Just think about this plastic bag being a mesh of blood vessels that's protecting it. So when you put it into the toxic, infectious agents, whatever is bad, yeah, it is well protected. If we look at the tofu inside, we see that it is not at all impacted by all of that dangerous, damaging material. But if we end up damaging this blood-brain barrier, if we poke little holes in it, which is what the overactive immune system does, it pokes little holes in it. If we do that, and now it gets exposed to any toxic, dangerous agent, then instead we see that, oh dear, that tofu is very much impacted by the infectious agent or any other damaging cells. So we really want to protect our brains and protect that very delicate tofu-like material. And the best way to do that is to not get COVID in the first place. So we know the many layers of protection we need to do that. And if, unfortunately, we have had COVID and we end up with long-term neurologic problems, it does take a multidisciplinary team, specialists who can help us to recover from that. And so you should reach out to your primary care physician, healthcare provider, who can help guide you to get some care.
All right, wonderful. Thank you so much for breaking that down for us and reminding us really of the long-term seriousness of having COVID. I don't think I'll look at my tofu the same moving forward. All right, so now we're going to head into inviting Afton Shavers to join us. Afton is the project manager for the Greater Flint Health Coalition. She also works with the Flint ReCAST project, and she's here to give us some more information about ReCAST. Afton, fill us in.
So how did I get drafted to go behind Dr. Wolford? Like, that is absolutely unfair. So I'm not sure I can complain to you about this, but wholly unfair to put me behind Dr. Wolford.
Blame Yvonne.
So I'm going to tell you just a really brief overview of a new Flint ReCAST project. And so we want to share with community. I know a lot of folks saw that we were awarded a new grant. There was a press release that went out. We did a little bit of media following. So just want to share with folks that we did receive a new grant. So we don't necessarily want to use the word refunded because this is a different project than what was funded the first time. So there was a new sort of request for proposals that we applied to on behalf of the city of Flint and all of our community partners, and we were awarded. And so this award once again does come to us from the Substance Abuse and Mental Health Services Administration, or SAMHSA, which is a division of the U.S. Department of Health and Human Services. The grant award officially starts today. So we're very excited about that. Although I might want to add that we do not have the funds at the moment. So I've got a lot of questions about that leading up to today. We do not have funds at the exact second, but we anticipate getting those pretty soon. The award is for $1 million a year, which sounds like a lot. But guys, it's really not as much as we think it is, because it's going to take a lot to do some really cool things. And so the tagline, if you will, for this project is that the Flint Resiliency and Communities at Distress and Trauma, or ReCAST project, is really to assist high-risk youth and families by supporting the recovery and rebuilding of our vibrant community through resilience and equity. So just a couple key words there. We're talking about supporting community. We're talking about supporting youth and families. So not just kids, but kids and families. And then we really want to be looking about not just the resilience piece, but also some equity work as well. Project partners are pretty similar to the original award, and that's because of what we have to do with the grant. So we have to have the city, we have to have an implementation partner, which is going to be the Health Coalition. We have to have a behavioral health partner, which has been our wonderful friends that you just saw earlier from Genesee Health System. We have to do some mindful work and also some activity in terms of like kids being active. So we have worked with the Crim Fitness Foundation, and the Michigan State University has served as the evaluation partner. So really want to point out that this is a very, very, very select group of people who were funded through this mechanism. Only 9 total projects from across the entire United States were funded. 4 of those are projects that had been funded previously. So Flint, Michigan, Bexar County, Texas, which is the San Antonio area, Oakland, California, and then also Milwaukee, Wisconsin were previously funded. So the other parts of the cohort are brand new to this task. Next slide, please. So just a brief overview here. I'm absolutely not going to read the whole thing to you. That would be obnoxious. But just so you kind of understand, if anybody asks you, what in the world is this new ReCAST about? We have 4 basic goals, and those 4 goals center around behavioral health, race and equity, youth support and development, and then public safety and violence prevention. And so there's a lot of work that'll be done in each of those areas. I wanted to be clear visually also with this image that behavioral health is the largest component. This is a behavioral health grant first and foremost. And so that is why it's visually bigger on the screen. And then the secondary piece that has to be bigger is the youth support and development. So once again, visually wanted to be clear about that. The things that are listed here are the objectives of the grant. There will be plenty of activities that take place over the course of the next 5 years that will do the work of the grant. And so there'll be a whole lot more that will come as we get rolling. Next slide, please. basic focus areas, if you wanted to kind of break down what we'll be doing, is that we're looking to continue promoting the use of trauma-informed practices. We definitely know that there's a lot of trauma within the community for a multitude of reasons, and we really want to address a lot of those layers. One of those being a new layer of the fact that people are really grieving completely different in the wake of COVID. And so we know that that's going to be something that evolves over time. And so we really want to think about that. Additionally, we want to build capacity for youth support. We definitely know we need our kids to be involved in after school, out of school time. We know that those are proven strategies for violence prevention. And so we definitely want to support that. Developing our vibrant community is really important and critical for us. So one of the things that we definitely know about communities in general is when people feel good about where they are, if they feel safe, if they have support, then typically they have a little bit less of the stress that may be induced by being in areas that don't provide them those things, specifically that feeling of safety. And so there will be a whole lot of things that will kind of fall underneath this threshold, but this is something that we think is really important in terms of moving our community into a place where we are functioning a little bit better. Behavioral health services, we definitely want to improve access countywide. We've been doing a whole lot along that line from the previous project that'll kind of carry forward. We will definitely be expanding our trauma-informed first responder community. We've done a lot of really cool things in terms of uplifting and supporting first responders. If you think about, stress and trauma in terms of COVID, and like the responders are getting to folks and trying to get folks to resources, services, obviously the folks on the front lines that have been doing a lot of the work with the hospital staff, but then also if you think like nursing home staffs and even just social workers, like there's a lot of folks that have been really in a frontline first responder like sort of role in response to COVID. We really want to do some things there that's going to continue to work to support that. We want to increase capacity for community organizations. One of the things that we do with this project is we support funds for small groups or small organizations that are doing some work to support families in community. That will absolutely continue. And then obviously we have to do some things that are evidence-based and comprehensive that are going to impact violence. We all know violence is huge in this community, and I want to be very clear, we're not going to solve the problem all by our little selves, but we are absolutely committed to working together in partnership with neighborhoods, with block clubs, with groups that really want to see some things change in our community. We are going to be very, very, very community engaged. And with that comes transparency. With this project, we're going to have a participatory budgeting approach. And so that will actually account for 25% of the funds that we will allocate yearly. There's going to be a couple facets that go into that in terms of like us having some open meetings, which you see on this side, but also some community voting, and we'll be getting a lot of feedback from residents. We really want it to be an interactive experience so that folks see and participate in the work of this project in real time. Along with the transparency, we're going to do public release of quarterly and annual reports. And go to the next slide. We're also developing a new website. So those quarterly and annual reports will be accessible and available from our website. We'll also have plenty of materials. We will be continuing to do trainings and workshops. We have a workshop we're doing tomorrow morning, actually, for some youngsters, middle school kids. So we're super excited about that, but we'll be continuing to do those activities, and they can request those from our website. Right now, we are certainly rebuilding the website. So if you go to it right now, you won't see anything, but here's our contact points. So you can find us on Facebook, Twitter, Instagram. You can email us. And right now our website is not up because we are reconstructing it, but that will be up and running pretty shortly here. And we're super excited. So if you have questions, issues, comments, concerns, or really just want to be involved, definitely get a hold of us.
That's wonderful, Afton, and we'll look forward to having you back to share more information with us. We're going to get a quick update from Lottie Ferguson, who is the Chief Resilience Officer at the City of Flint. Lottie, got some quick information for us?
I do. I have some very quick information for you. Just wanted to be sure that folks knew that as of yesterday, we've reached phase 2 towards facilitating the incremental water increases on our secondary pipeline. So we've gone up to 25% from one source and 75% from the secondary pipeline, and excuse me, my numbers are all messed up today. 25% on the secondary water pipeline, and we're at 75% on the primary water pipeline. Updates on the project, the pipeline alignment repairs at the treatment plant are finished. We've got permits that have been secured to allow electrical service to be installed at the vault on Francis Road. Valve and meter calibration upgrades are going to continue. And decisions about future incremental water increases will be based on the monitoring data collected. We are sampling as we go. All protocols are in adherence with the State of Michigan Safe Drinking Water Act and with the city's agreement with the primary water supplier. If you have any questions or if you have any issues for water emergencies or issues related with water service, please call 810-766-7202. For sewer, call 766-7079. Both of those lines are monitored 24 hours a day.
That's wonderful. Thank you so much for joining us, Lottie, and keeping us informed on what's going on in the city. Up next, we've got Dr. Deborah Verholden. She's going to fill us in on the health equity brief, give us some numbers and break it down for us. Thanks, Dr. Deb.
Okay, great. Case counts going again in the wrong direction. Numbers went up in Genesee County compared to last week, and we are now on our 13th consecutive week of increase in the city of Flint. Testing positivity rate, it only went up slightly, that's 9%. So that's of all the people who are getting tested, what percentage of those tests are coming back positive? And we've basically been hovering around 10% for quite some time. If you look at the numbers, we've added in again, just to recap for people, some additional numbers. We report, so like right now, this is the week that started September 19th. We have probable cases, and those are cases that have not been confirmed by tests, but are likely cases. This is a really important metric that the CDC has recommended that people use because it gives you a better sense of what infection might actually look like in your community. And then we've got these lag cases. So what we reported last week, an additional 56 cases came in. I can't see that. No, I'm sorry, 86 cases for Genesee County, and an additional 12 cases came in Flint, right? So we, sort of locked and loaded the numbers, closed them out for the week. A week later, more cases come in. And the reason that I point that out to people is I just want to give people a really clear sense that we are not going in the right direction, and the numbers are not on our side. So prevention. And after hearing Dr. Wolford's talk and demo this week, yes, I'm even more enthusiastic to wear my mask. Next slide. Roll through this. This is just a little tidbit we have for people. This week, you got to sign up, get the health equity brief. You can email croft457@msu.edu. You can also go onto our website, which is flintcenter.org, and sign up for the brief, and you'll get some great info and insight around, masking and the fact that schools without mask mandates have a lot more COVID spread. We've got 2 recommendations for our policymakers this week. For time, I'm not going to go into detail. And again, I'll tell people, get the brief. It's got good stuff. It's current and relevant. And we're trying to give them a good dose and good punch of equity. So we're asking them to invest in healthy communities and to support mental health crisis response. Thanks.
All right. Thanks, Dr. Deb. And as a reminder, you can always go to the FCHES website and check out the previous versions of the brief in case you missed something. All right, we're winding this down. This has been a great hour to enjoy with one another. We got some great information. We can't forget that we have continuing education contact hours for social workers and community health workers. Make sure you fill out the survey that's going to pop up once you exit the webinar, because we want to make sure that we provide those for you because they are offered for free. If you have any questions, you can contact Mary Catherine Crawford at croft457@msu.edu. And as always, we ask that you would like us on Facebook, subscribe to the YouTube channel Healthy Flint. You can also look at the archived versions of this webinar that are available there. You can always email us with questions or for more information at info@hfrcc.org, or you can give us a call at 810-835-2130. Again, that's 810-835-2130. 2130. If you have questions or ideas of topics that we should be covering, please give us that information. And we will look forward to seeing you next week. Have a good weekend, everyone. Thanks so much.